Happy
Hello.
Friday.
Happy Friday.
Hello. Here we Lisa, is that a mojito?
I wish, dude. It's water with mint in it.
This is a non-alcoholic mushroom infused drink, but not like the magical kinds.
I was gonna say, are you gonna start tripping while we're doing the show?
No, it's supposed to make me live forever though, so we'll see how it goes. I don't know.
Okay.
All that for like $30. I don't know. Not each, like per case that I bought on Amazon. But it feels like it's doing something, so that's good. All right, we missed last week because I don't remember why.
Lisa was traveling. It was
I was
her
Oh,
traveling.
bachelorette
okay.
party.
Oh, love it.
Not
Okay,
mine, not mine.
great.
My one of my sisters. Not I am already married, and that's fine. Just to be
Oh,
clear.
yeah, yeah. I mean, you can always keep having parties. So, all right.
True.
So we had a lot that went on. Melissa, anything that went on in your life last week that
I
our
got
viewers should know about?
I got to spend the week with Lisa. She got
That's
to
right.
sit in my murder hotel room.
It
Mm.
was pretty bad. Like, actually, I just think if, Insena, comma LLC would consider
It was
putting their employees in better hotels than the fact that I was staying in a better hotel than Melissa was a real turn of events.
I normally
So,
get really nice hotels. It was
what
a
happened?
conference. You know how I have this also, I want to point out I break every shower that I stay at. I peeled the whole back of the door off of the shower.
What?
Like I hung, yeah, I
Oh
hung
no.
the I hung the thing that holds all the things for your travel stuff, like your toothbrush, like it like folds and stuff. And I hung it, and it smelled like must in the room. And like when I hung it, the door peeled off.
Listen,
Like
so shout out to Milwaukee. Everyone who doesn't know, we were at the Medicaid Enterprise Systems Conference, and as far as we can tell, there were two nice-ish hotels downtown, and I was staying at one of them, but it did run out of, there was no air conditioning for the first day for flood reasons, because there was literally a flood in the city. It was very bad. I feel very sorry. It is a very nice city. We had a bad couple of situations.
shout out to Kemper for offering to keep us all in her suite.
Shout out to
I'm
Kempertel.
just
I mean,
just
listen,
for loyal fans that believe that Insena is fancy and glam. We are. Our people are always in nice hotels. What?
I'm
This
not in an Omni normally. I'm in a very nice place. I don't normally complain about my digs. I complained about the
I
first one
saw
because
it
I
with
broke
my
the
own eyes. That's the only reason why I'm complaining for her because I saw it
what
She
and
was
sat
it
it?
was not
Which
great.
one?
the Hyatt. She sat in the kill chair. There was like this very awkward suede chair that was propped like this, staring at
We
my bed. And like
you
the
do
person
know what? Okay.
felt like I was
Listen,
anyway.
listen, everyone. It was, you know what? I don't know that we got the best side of Milwaukee. That's all I can say.
Yeah.
But I got to
Okay.
spend
Well,
time with
It's great.
hey, but you know what we should do before? Actually, we'll bring our deck up, and just because it's a great picture with these owls. But I actually had several people reach out to me and say, "Did you or your people attend Mask? Because there isn't a lot of coverage on it, and everybody's curious what's happening in Medicaid." So I was not there. You two were there. Tell our loyal fans, give them the dirty, dirty.
Okay. They're going to use AI.
a lot of it.
That's the end.
Well,
Like,
I love that.
yeah.
They had
Yeah.
a
I
lot of
mean,
people. It was like 2,000 attendees, I think. It
there
was pretty.
were. There were.
Huh.
I mean, everyone's a critic, including me, but as someone who has put on a lot of conferences, I just have to say, I feel like the team behind the conference did not do as much work as they might have otherwise done. It was not, in my opinion, like very well coordinated.
Hmm.
Well, the guys from MESC told me that the Brony conference that was taking place in Baltimore wasn't they the bronies, like the little ponies, the Jews that dress like the My Little Ponies. There was a conference in Baltimore that they had to break down and didn't leave in time to put up the MESC conference. So like it was slightly delayed.
Yeah,
I
and,
forgot
and
to
when
like
I explained this to someone, they were like, "Wait, what?"
yeah,
And
I
I
know.
also was like, "What, Melissa?" But apparently, there's a connection between the Bronies conference and MESC, which is very upsetting, very concerning. But apparently, that is why MESC felt a little bit ramshackle because the same conference company was like working on both conferences. Do with that information what you will.
I will
I
say
mean,
I would be interested on seeing the Brony conference. Just saying.
Okay,
I think
great.
I think God bless America. We are free.
We contain multitudes.
When Medicaid is being held up by grown men dressed like My Little Pony, that's when you know things are getting really serious.
Things things are getting things are serious.
Yeah,
Yes, good point.
yeah,
Yeah. Okay. Well, we have
Yeah.
some other like little tidbits in this deck, which we can talk about the Medicaid, but that sounds great. So to our loyal fans who are curious what happened at MESC, the Medicaid Enterprise Systems Conference, very sexy. What happened there is AI.
yeah, yeah, yeah.
Great. Melissa, we're sending you to the back. All right. All right. Okay. This slide is chaotic. There is no guest on this show because Lisa and my favorite shows are when it's just us talking to each other. So that's what's happening. We have a lot of news to cover. We have a lot of opinions to share. And then we have the very unprepared things we currently love and things we currently fucking hate section, which is at the end. Plus, we have one little surprise at the very end, like a last minute addition for a loyal fan.
Amazing.
So that's great. So I think this slide, our cover image this week was supposed to be the who's who, because like owls, it turned into what we love and what we hate. So that's great. Very exciting. All right. Lisa, you start. Yimbies.
Yeah, I mean, wait, this is Dan's, right? Did I make this up?
Yes, in my backyard.
This is no, this is Dan's op-ed. Did I make that
Oh
up?
yeah,
It
yeah, yeah,
is.
yeah, yeah,
Yeah, yeah.
yeah, yeah,
I
yeah,
just
yeah.
forgot. I forgot that. Okay, so okay. First of all, those of you like long time fans may know that Dan O'Neill and I used to work together back in the bad old days of
Best
Practice Fusion.
friends.
He's such a great guy, and he is so smart about policy. He also did a fellowship at Senate Help, and just really is like, you can't stump him on anything healthcare policy related. And he's also not afraid to call people out by name. And so I really encourage everyone to read this and see that he's actually standing behind his words and calling out insurers and others who have made it really hard to stand up a new primary care practice. He works now at Pine Park Health. They do essentially home-based primary care for seniors where they go into assisted living facilities. And wow, he has been through it in terms of um, getting like, licensing and joining plans and doing all the requirements. And he's like, let me tell you exactly how hard it is and how expensive it is and how ridiculous it is to set up a new practice in these United States of America. And I just commend him for not being afraid to call people out by name here. And so just shout out to Dan. Also, spoiler alert, I'll give you the spoiler alert later about Dan and a little bit more discussion on some of these topics. But he is super smart and he's talking about what is actually slowing us down and costing us money, and who is the source of these administrative obstacles in improving primary care.
Who is the source, Lisa?
I think Scan Health Plan.
Really? It's all them?
Oh,
Fucking
he
A.
there's plenty of others. There's just one of many that are called out in great detail about the kind of burdens and barriers that they put into place.
Mm,
And so it's really
mm.
just like, it's because we have so, like, one of the points he makes, like in this and later, spoiler again, is like, in fact, we have so many health plans and so many payers in America. We have a lot of them. Like, we don't, the big ones. The long tail is very long, and they're all doing the same processes, the same things that Medicare does, but like slower and worse. He's actually like, Medicare's fine. He's like, there's so many of these guys. There's so many health plans, and we're doing the same things again and again. Like, why do we have a different provider directory? Question mark. Why do we have 100,000 different ways of like enrolling providers? Why do we have so many different rules and different ways to do licensing and all those things that you have to do state by state? Listen, like, he's like, this isn't efficient. It's not better. We're not getting something new out of it. So just some real food for thought here.
Food for thought, America. Yeah,
Food for thought.
there's a lot of drama llamas here. I just recently, again, I feel like every 2 days someone asks me, Kat, if you could do one thing to change American healthcare, what would it be? And I always tell them, Lisa, I would say And like this all shocks them because like, I love the free markets. I go single payer, Medicare Advantage for all, single payer, different than your
Bam,
Medicaid Advantage for all, Medicaid for all.
bam,
But
bam.
and then I say like, if I could have like a plus one on that, it would be pay primary care more, mostly because you tell me that's a great idea. So, this would be great. So,
Mhm,
yo,
that's
Scan
right.
Health Plan, WTF. Also, Sachin Jain, you write such hilarious LinkedIn posts. Why
Dude.
is your organization the worst, according to
Yeah,
this? I
Sachin
don't know.
Jain, sit down with Dan O'Neill and we'll broadcast it live here on the Health Tech Talk Show and you could answer him directly. Let's do
Yeah.
it.
I mean, yes. Yes, sir. Yes, please. All right. What else? Okay. Oracle has a new EHR.
So,
Would you
like,
like to hear my thoughts?
was it like a year ago that they announced they were going to do this? Now they allegedly did something. So, question mark? What do you think, Kat?
Okay. Here's here's what I think about this. AI is great. Yay. I'm here for it. Voice first, I think, is dumb for a lot of reasons.
Yeah, have you
Because
ever
I
tried to
also
use
think
Alexa? It's not great.
it's awful. It's awful. And I did read. I thought this. I was like, voice first sounds dumb. It doesn't sound like anyone spent a lot of time with providers, actually seeing how they work. Like that's my guess on this and reading this press release, which I haven't seen the EHR. Like no one's given me a demo, Lisa, but like based on what I've
Yeah.
seen on the internets about it, that Oracle has released about its own EHR, it doesn't seem like they've spent a lot of time in a hospital, or this is an ambulatory EHR, but or even like following providers around. Like it doesn't. It seems like they're just like, you know what? If we could redesign a practice and the medical workflow from the ground up, this is how we would do it, and that's like not how it works.
Well,
So,
it's interesting. Like I've been
ah,
thinking about this question, right? Like I've been thinking about like how would we redesign it, right? And I think voice is part of it, but like voice first, what?
well, yeah, and I think there was an important note that Brendan made, and he had a little post about this. It was actually not little; it was very long. But yeah, his point was like ambient listening is different than voice first. Like, are we talking about the same thing? It doesn't sound like it. No. So yeah, I don't know. The other thing I'll say here is like I don't understand why no one listens to me, Lisa, and they don't listen to any of my talks that are about why the best product doesn't win in any market.
Yeah.
It does not win,
Yeah.
y'all. The best product doesn't win. I'm not saying this is the best product. Like I said, no one's been like, hey, Kat, why don't you fly out here in first class and we'll give you an in-person demo and also buy you a steak dinner?
Mm,
No one has said that to
mm.
me. But like, also, the best product doesn't win. So even if this is the best, even if they actually went through and did provider workflow and all that, even if it's priced the best, all these things, that doesn't mean it's going to win. So I'm just like, why the hell are these companies still competing on product? Like they should be competing on service, customization, like all the things. Like that's what they should be doing at this point. This is a saturated, mature market. Why does no one listen to me?
It is interesting. No one flies you out first class and gives you a steak dinner. It's actually not that
That's what I'm
expensive.
talking about.
Like you live
Right.
in a major hub, like steak dinner, what is it going to cost? $1,000? It's one banana. What could it cost? $10? Who knows? But
I
like
mean,
not that much money. I mean, come on. Like
I will
relatively
say my plane
speaking.
ticket, living in the Delta hub of America, of the universe, my tickets are expensive. So I do get that. But, anyway,
That's
the
true.
point is like,
That's true.
I don't know.
That's true.
Like, we've been hearing about this. I'm sure it's cool. But is it cool enough that you're going to actually flip over all of the Epic sites that have
Right.
left Oracle in the past few years? Probably
Well, like
not.
that's not the issue, right? Like the issue is not like, ooh, I know that there are some Oracle products. Now we're talking out of school here. Speaking out of turn here. Um, that are not very good, that have had, long-term implementation. They're not Oracle products, right? They're all the many products and companies that Oracle Health, Cerner acquired over the many years, as many companies do. They have this, big like tech debt from acquisitions, whatever. I know some of them didn't work very well, but like I'm almost certain that was more of an implementation and a customer success, customer service thing. Like you're saying, like compete on making it better for your existing customers. There are customers right now who would like to not leave. But none of these big AMCs are going to be like, okay, yeah, just kidding. We spent $1.9 billion on our Epic install and changing over to Epic, and we're gonna stop that or we're gonna reverse it to adopt Oracle. What?
Yeah, I'm also, again, I haven't thought too much about this, but just knowing that this is an ambulatory EHR to start,
Right.
They're competing. I mean,
That's
that's so we're not. I
that's a
mean, they're not
shitty
competing.
market right now.
I'm confused about that.
Who
Interested,
is
you
your
know. Well,
customer? Who is your
like I
customer?
said,
Yeah.
no one has
Yeah, yeah.
invited us out to give them a
Listen,
speech on go to market in first class.
I
But
like to give
um,
free advice for fancy trips. So, just consider it, everyone. Pay for us to
yeah,
go to a fancy place in first class, and we will give you our unfiltered advice.
yeah, I'm confused.
Yeah.
It's really hard to go SMB to enterprise. So, like, in
Yeah.
fact, so hard that like it's mostly not done. So
Right.
I don't know. I mean, good for
Man.
them. I'm glad that they have all this money and they could make this EHR. It's
Sure.
freaking
We'll see. I mean, we could be wrong, right? Like we are also potentially not that smart, and there's might be something we're
often
missing
wrong,
here.
never in doubt. Hmm?
Often wrong, never in doubt. We could be wrong.
Just two
Who
girls on the
knows?
internet.
That's right.
NBD.
That's right.
Oh yeah. So speaking of the AI, it sounds like everybody's buying it, and it might be like a hype cycle situation.
So it's definitely a hype cycle situation, right? And it's obviously become a litmus test as well for your investments. I remain interested in things we can do to use technology to improve health outcomes and reduce cost, right? If you want to call that technology AI, advanced analytics, whatever. I remain
Yeah.
in that front. But the kind of money that is flowing around, especially here in San Francisco, in the San Francisco Bay Area, wow, a lot of money is being lit on fire by some of these companies. And the reality is, I don't know if that money is going to like improve technology or like outcomes for people. This is in healthcare and obviously in other industries. Like, let's, I'm waiting to see what actually happens. And it feels like the harms are pretty high in terms of like lighting money on fire to not invest in other things. Talent wars, so to speak, between like big Silicon Valley companies where they're paying like millions of dollars for like the latest person who showed up in a video with Sam Altman. Like,
Yeah.
dude, come on. That's ridiculous.
Yeah. I mean, I wish someone would see our value so that they paid us
Yeah, I
millions
mean,
of
to be
dollars per
clear, like if anyone
year.
wants to pay millions of dollars to fight for me,
Call
my
us.
incredible talent, I will take it.
We're right
I'll
here.
take it.
Like
We're taking.
you
Yeah,
can find
that's
us.
right.
We
That's
are
right.
on the internet.
That's right.
We are
That's
very,
right.
as Lisa says. So yeah, well, to that point, like to harm, it does seem like everybody's doing the AI, and in some cases, yeah, like it's not always. AI does not mean it automatically fits into workflow. AI does not automatically mean it has market fit. AI does not mean a lot of things that actually matter for getting your product traction in the market. And again, I'll go back to the best product doesn't win. Like it doesn't win. The product Sometimes the product that's marketed the best works. Sometimes the product that is most usable works best. So, I mean, look at us an iPhone and like all of the memes out there and videos about how Samsung actually objectively has a better technical product and no one uses it.
Yeah, what about that? Like, what about the folding phone? Samsung has had the
That's
folding
what
phone for a
I'm saying.
while, and that's like
I'm saying
actually probably
it's
better for a lot
cool.
of people. Like, kind of cool, but like, no. I mean, yeah, the folding phone not winning any users.
I'm
It's
not
really
doing
the
it. I don't want
ecosystem.
I don't want my text to turn green, Lisa. That's
Yeah,
why.
yeah.
That's why.
My
It's
my
not a
friend
product,
here.
best product situation.
That's right. Michael Marchant, our friend here, says that AI also means natural language processing, machine learning, and then I don't know if RPA counts as AI. Automation. I mean, is it being used that way, Michael? Yes, it is. But like, it's very expensive to call robotic process automation AI when it's like it existed before we called it AI and charged a bazillion extra dollars for it. Like, is that what we're going to be using these tools for? RPA? Like, yes, because we're not going to invest in like deep integration and APIs. We're just going to be like, use this bot to solve this stupid process that we could fix if we just like did it right. No, let's send an agent around to go and like click on different browser tabs, like kill me, right? Like, I
Well,
get
that's what
it.
I'm saying. Yeah, I mean, apparently we don't need to fix EHRs because the AI, the agents are going to fix it.
That sucks, man. I don't know. I mean, really, in like the innovator's dilemma, or we're about to get into the trough of disillusionment of AI, right? I think we are like just
Yeah,
cresting the curve into the trough of just disillusionment, and it's going to be like a long, cold winter that Kat is always worried about slash planning for. And
ready.
like, I think that is where we are, but like a lot of people, a lot of companies are lighting a lot of money on fire for not great reasons right now.
So, we'll see what happens. We don't know. We don't
We'll
know.
see.
We kind of do know. We think the trough is coming. It's coming.
That's right.
Speaking of
Speaking of
things that may have happened,
speaking of folks being out competed or slash trying to find new competitors or new markets, shoot.
yeah, hold on. Yeah. So, I'm a little, so loyal fans, I am a little bit out of order today because I did this slide deck a
Uh-oh.
few minutes ago. So this is also related to the news that Epic is it has launched an internal AI scribe on the insides. And so everybody knows like the scribe market, like everybody freaking loves it. And so now that is now an internal feature for Epic, which does not mean, to be clear, that you can't still use a point solution. But yeah, uh,
Well, I
it
mean,
seems
so
like a
the
lot of
difference
the
with their
wind here.
bridge, the difference with their bridge is that they had a deal with Epic, which was very unique, right? Like Epic famously doesn't acquire, won't sell, whatever all the things in their Ten Commandments are, right? Like they would not do that. They did have like an actual commercial partnership of some kind with Epic, and then they went and just announced that at UGM, which I guess is what, next week or something like
I think
that.
it's next week. Hmm.
Yep, and that Epic is going to announce and talk about their new AI Scribe. That's a Epic built application versus a third party or a whatever App Orchard is called today. Okay, I mean, I just first of all, like, not surprising that Epic built this, right? This cartoon here illustrates that, right?
Yeah,
But
credit
also,
to Nathan Heyman on LinkedIn, by the way, loyal
that's
fans.
right,
I forgot to
that's
point
right.
that part out. Yeah.
Probably credit to an
Um,
AI, but that's fine. And I like, are we surprised? Nobody should be surprised. I don't know.
Yeah, I agree. And it does sound like here our friends at Abridge have decided that they are going to provide additional value. So now we've got the real-time prior off right at the point of care with the AI scribe situation going on. So that's exciting. Yeah, I mean, obviously there's some market movement. There's some regulatory tailwinds around prior auth. There's also some pen stroke risk here. So, I mean, I get it. But this certainly is probably not the pillar on which a bridge will preserve its market.
Well, all of these companies, including Ambience, are going to expand into other areas that they feel are profitable, right? Prior authorization, coding, all these other services, right? They're expanding what they do, or they're claiming they were always planning on doing that anyway. And, going into these other markets and really trying to expand on these types of services that are built around data and AI tools and sort of being already integrated allegedly into the EHR. So, TBD if that works. I don't know. I don't know.
I don't know, Michael. I feel like Jocelyn is expensive these days, but I feel like
Yeah,
they also have money right now. So good,
that's right.
great idea. Okay, cool. Yeah, and Michael did confirm UGM starts Sunday, so that's exciting. We already talked about Brendan's thoughts on the AI native EHR. I think basically he says that's a funny one. This one basically he says like, yeah, voice first is confusing. He also criticizes the press release for confusing, I think, agents and co-pilots a little bit.
Yeah,
So there's some confusing
that was
language that he didn't
funny.
like. Yeah, as usual, read Brendan's posts. They are interesting and long if you like the long LinkedIn posts.
If you're a long reads,
Okay, Josh Mandel, this guy, like I I know he has a real job.
he
He
does.
maybe because he's great at the AI. This guy is outrageously productive. Like,
Yeah,
did you
yeah,
see his
yeah,
little
yeah.
website? It's not little, like his website where you can
I
like
know.
submit your denied claim.
Yeah, no, no, he's doing a lot of stuff.
Like
I think
this
he's being
guy.
very productive. But he's mostly been like putting out you know, like commentary on some of the CMS health technology ecosystem stuff that does seem a little bit AI written. There's like summary of comments and things like that. But this one so his thing now is he's doing like comment analysis of like what people put out there in response to CMS or HHS regulations or RFIs. And this one was much more pointed. It was just like
Yeah.
literally here are a bunch of comments from like medical doctors, clinicians, providers who are like this is gonna really, really hurt a lot of people just from personal experience, personal opinion. I thought this was very
Yeah.
powerfully written and powerfully presented. And so shout out to Josh, who is like mega health IT nerd and medical doctor, and also big important dude at Microsoft Research now.
Yeah, this guy is like an ultra nerd, but like in a great kind of way.
But in
And
a
if you do
great
read,
way.
yeah, like read this piece because it isn't like basically, he goes through all the comment letters. No one is like, this is a fucking
Everyone's
like
like, I'm
no
a
one.
Republican. This is going to hurt people. Like they're like, I am a lifetime life. I swear to God, I'm a Republican. I swear, and this is bad.
Yeah, this
Just a
is bad
side
news.
note from Sergey, just a little comment from our friend Sergey here about Epic's AI Scribe and telehealth. So TBD, Sergey, we will all find out soon, presumably.
We will.
Um, TBD. I was not invited to UGM this year, so I will not find out myself. But I'm sure we will hear from all of our loyal fans who are there, of which there are going to be quite a few, which is exciting.
Yes,
And
many people are.
also, before I forget, Sergey and I are going to meet in person in New York City at the Prax Summit in September. So get ready for that. That's also going to be amazing. And yeah, TBD. We'll see, Sergey.
Yeah. Lisa, I don't know if you guys know this. You might say Lisa is a naysayer on the AI, but she's actually an expert and is speaking often
Talking at an
about the
AI
AI.
conference. Look at me.
Who freaking knew? So that's the move. Yeah, and to Sergey's point, yeah, there are sometimes point solutions where hospital buyers will pick the point solution if they have a progressive C-suite technology leader, some sort of chief transformation officer. A lot of times they will choose the best product. However, what we see most often is this is now just a little too hard for a lot of facilities. And so they will
Mm,
pick the product that is right in front of them, that's included, that's easy, that's already integrated, as opposed to the best product. So again, the best product doesn't win. I have no idea if Epix is good or not. But my guess is that this will rapidly deteriorate the AI scribe market. That is my personal opinion
that's right.
based on based on years of experience.
Yeah, I mean, like, what's that percentage difference? Who knows? It's not going to matter to everybody.
Yeah, yeah. I don't know. Oh, look at like our number one super
Yeah.
fan is here. That's
Oh,
right, Scott.
oh, oh.
What's up?
Yep. Got my
What's up?
team
Oh,
interrupt
oh,
tee on. This is a shout out to Direct Trust. This is the Direct Trust special, and I am wearing it today.
direct trust special. Oh yeah. Okay, yeah. Speaking of AI and people going down the rabbit holes that maybe are not the best.
Jesus Christ.
So there's been a few articles the past couple of weeks and definitely this week about delusional chatbots and how they actually drive people insane.
This is
And so
so
this is just
sad to me.
this
This
is
is
this is
so
so sad.
sad.
This is so sad. I think this is one about a gentleman who was led to believe for several weeks that he had the key to everything in a mathematical equation that he found through the AI. And this chatbot was basically telling him he was like going to be the great Messiah, second coming, or something like that. And he was unwell due to the AI. Lisa, are you dying? Are you concerned about the chatbot as well? Yes, you are. Wow. Wow. It was that minty water. Yeah. Anyway,
It's
loyal fans,
probably just the COVID.
it's probably is it the Rona? Did you get it in Milwaukee along with the moldy bathroom door?
I think
Yeah,
so. Yeah.
it's not good. It's not good, loyal fans. Anyway, so the point is, if the AI tells you that you are the second coming, I think it's worth a break. It's worth a break. Same
No,
here. This
go
oh,
back for a second
did you
because
want to comment? Are you
I
back? Okay.
do. I'm just dying of I don't know, probably Rona. Um, And I'm really not crying. I'm just crying because of coughing from the Rona, not from being sad. I am sad about this though. Like I just like I want to say this to everyone. If you are starting to develop any kind of parasocial relationship with a chatbot, like disconnect your internet, turn off your computer, throw it in the ocean, and walk away. The end.
Yeah.
It's not
Yeah.
real. I
It's not
promise you
great.
it's not real. It's not real. I know that's not fair to say, like this is written in a way and the way that these things are kind of unleashed on humanity without any safeguards is really bad. This is not a good development for us. It's not. We're just like really not like mentally and emotionally developed enough to deal with this kind of stuff. It's too much. Throw your computer in the ocean.
Yeah. Well, it's scary too because it's a whole trust issue, right? Like in addition
Totally.
to the fact that like yes, you if
God.
you start to have feelings for a chatbot, you should turn off your computer and touch grass. You should just lay on the grass. You should go camping. You should throw your phone in the river. You should go to
Yeah.
a coffee shop and talk to
Yeah.
real humans. Like this is not great. Not good stuff at all.
Oh
But same
man.
thing. I mean, it's one of the concerns. There is for patients getting having medical advice from AI chatbots as well too, right? Like, I was using the AI today, and I was just trying to get it to like generate the most recently cool Series A companies in health tech for a question we may have later, and it was completely not correct. Oh, I mean, Michael, it's up to you.
Yes, disconnect them as well.
Yeah, I'm of the opinion that yeah, you gotta keep your circle small, especially as you become famous, Michael, from the Health Tech Talk Show. You gotta
That's
watch out.
right. That's right.
Everybody's gonna want to
That's
be your
right.
friend. Everybody's gonna be your friend. Anyways, this is sad stuff. This is also this was a special report, very similar to the last, except there was a elderly gentleman who fell in love with a chatbot who convinced him, even though he knew she was a chatbot, to come to New York City to meet him. And I believe he tripped while lugging his suitcase and was passed away
He
from the
passed away.
fall. And yeah, awful, freaking
It's
awful.
just like where I mean where is the safety component to this, right? Like there isn't one because these companies, especially Meta, are focused on growth at all costs, including harming people. And it's just such a bummer that there are no safety guardrails at all. Like why would there not be some external like, you know, intervention before a chatbot in a conversation can give someone a fake address and say, "Come and meet me here." No, really, I swear I'm real. Like, come on, dude.
Yeah.
That's just silly, right? And are you going to talk about? Sorry, we haven't even seen these slides, loyal fans. Are we going to
Oh, we
talk
haven't.
about the Whoop thing and FDA oversight?
Well, very exciting news. That is coming up, though, not yet, because we are still on the AI
Perfect,
trend that
perfect, perfect.
apparently
Great, great, great.
this is Brian Anderson from Chai gave this interview or gave some parts of this interview to Politico on a topic that I think is a no shit topic. AI is not ready to replace in-home healthcare workers. Y'all, I don't know why this is an article. Like, do we all know what home
Yeah,
care workers do? As in this picture in Politico, they lift people around, they wipe their private parts when they have to go to the bathroom. Like, I'm
right.
sure we could get robots to do this eventually, but like, what the actual fuck did
I
we
mean,
waste our time
I have to assume and hope that Ruth didn't write this headline. Now, oftentimes, the headline writer is not the same as the journalist, and she's a smart lady. But like, I just find this to be such an annoying thing. If we are not 100% focused on using technology to like reduce burden, like to truly, minimize the amount of stupid steps people have to go through, the barriers, the paperwork, just so we can maximize the kind of time that they have to spend with each other, providing care directly, hands on bodies and, eyes to eyes, just people in the room. Like, come on. What else are we
yeah.
doing? Like, give
Well,
me
this
a
is even
break.
my stress about the AI nurses. Like, do we not know what nurses do that we think we can just
Yeah, dude.
turn them into like, okay, maybe on telehealth some people want to talk to a fake nurse. I
I don't.
don't, but like this is ridiculous. I did actually read this article, be impressed, little fans. And it did talk about like it was this article was tied to immigration and the expected home care worker shortage, which they're already not paid very well. This is a really hard job, right? You're often dealing with individuals who really need quite intensive physical labor care. And so it was saying like maybe AI is a solution to the immigration crisis.
No, it's
It's
not,
not.
dude. It's
It's
not.
not.
It's just not. And also, I mean, I have to assume that people who are building these kind of tools are like people who have never been really sick or had their families be sick or never had to really seek complex care or had lots of exposure to the healthcare system or the social care system, whatever of it remains. Because if you think you can replace a nurse with AI, then you probably had the great fortune of not having to interact with the healthcare system in a meaningful way. And that's
Yeah.
just what it is.
Yeah. That it's you're someone who thinks that this might be at home telehealth and not
You're
home
thinking
care.
very transactionally, and you're like, what if I replace
V-
this one thing with this, bot?
Yeah.
Okay,
It's not good. I
cool.
mean, we're talking about lifting people into the shower or the bath or whatever it may be. Like, it's not, no, stop, stop, stop it.
Stop it.
All
Cut it
right.
out.
Yeah, this is whoop. This is whoop.
This is Whoop. So this is a saga that continues. Basically, Whoop is like I don't know, like a Apple Watch Fitbit
Type of
vibe
thing.
thing. Yep. And they
Vibe.
whatever. And so they have this feature that basically is giving like a blood pressure reading, and the FDA warned them and said this feels like a medical device. They were like, no, it's not. It's about wellness. And it's like, okay, except for it's pretty well established what the FDA actually regulates around medical devices, and they're, let's just call it skirting the line a little bit. Apparently, now they've decided that they have the administration on their side and they're going to fight it until whatever. And they're basically saying, like, screw you, FDA, like, we're not going to be regulated by you. And the reason why I brought it up before around the AI conversation is because this is also a little bit like OpenAI saying publicly in the announcement for ChatGPT 5 that people should use ChatGPT 5 for health advice. And let me tell you, friends, like, once you're giving health advice, once you are actually like trying to advise people on their healthcare through a digital platform, you are in the world where you should be regulated by the FDA. Now, we don't love that. I get it, but like that's how it goes. And there's a reason, and that is that there are at least some safety standards, a little tiny bit of safety standards. So,
Yeah, I'm trying to. I mean, there's a couple things I think about this. First is like I recognize that everybody has decided that the
the
government is optional in terms of choices,
government is optional.
and also anything the government has done before is also optional because it's the new era. Like I understand that's
Right.
the current vibe out there. So I'm reading what the Whoop guy said. But yeah, he's basically saying like this is basically the summary of his piece. Fuck you. You're wrong, FDA. Not
That's right.
you clearly don't know stuff. We're going to do it anyway. And we're also going to go on Squawk Box and tell everybody about it because this is the new era.
And now he's
Like,
gonna be like,
ah,
I'm a hero, I'm persecuted. And it's like, that's the most annoying thing to me. Like,
it
no,
is
my
the
friend,
annoying.
like, that's annoying. But Scott makes an important point here too, right? Like, liability is also part of like regulated products, right? So if somebody gets harmed, like by any of this, by getting the government is just a vibe, Christian.
Seems that
Right
way.
now, it's very much a vibe. And like, it's just like, I get it. I understand, like, wow, you're so cool, amazing, super impressed. But like, I just don't like, come on, like, there's a reason why there's a reason we had food safety, right? Like, that you could buy in like a commercial setting used to like repeatedly and constantly be like contaminated food, right? Like they like
Yeah.
watered down milk with lead or whatever. Like there's a reason why this stuff happened. It's because left to our own devices, sometimes things went wrong. Like there's a reason for at least some basic level of safety. Let's do it. So
Yeah, I
dumb.
don't know. I also just in general disagree with the approach. I feel like when you do this, you cut off all of your opportunities to negotiate in a meaningful, good way.
Right.
Um, yeah, I think this administration has proven to us that like it's not really into getting the middle finger and then being nice later.
Yeah, like this whole like public posturing here is like quite a choice. Like I wouldn't do it.
Yeah, that whatever. I guess we'll see what happens, and
We'll
we'll
see what
probably get to
happens.
watch it on the Squawk Box.
That's correct.
Okay, So in terms of other so this is obviously not communications news, but I'm going to turn into later. So obviously awful shooting last week, on Friday of last week when we did not have our show, the CDC, an individual was apparently upset about the COVID vaccine and completely shot up the CDC in Atlanta, killing an Atlanta police officer. So
Super
awful.
messed up. So awful.
Yeah, pretty freaking awful, and we can certainly say a lot about that. There's been a call all over recently about how there hasn't been enough attention on this shooting. Lisa, I have thoughts, but what do you think about the lack of media attention?
I think it's horrible. I mean, I feel like so sad for everyone at the CDC, for the family, and the colleagues of the police officer that was killed, right? It's just horrible. It's just horrible. And I also just don't even freaking get it. Like, what are we talking about? The COVID vaccine isn't freaking required. And it's been years since anyone has been forcing anyone to get a freaking vaccine. Calm down. I mean, this is the problem when you have crazy people who have unfettered access to guns. It pisses me off. And I'm just really sad for all the people who work there and everybody who was affected.
I mean, not to try to determine that there's some sort of rational thought here behind someone who chose
There
to
isn't.
shoot a 500
Yeah.
bullets, as Caitlin's post said, into the CDC in Atlanta, which, by the way, did not make the COVID vaccine, just in case anyone is curious. But they also recently, all of the things that this individual may have been mad about, mandatory, all the things, have been removed. So again, there's probably
What are you
not a
doing,
lot of
bud?
like, with someone who chooses to do this is unwell, and that's a thing. But there is one thing I want to say about the lack of coverage and lack of communication. I think HHS, I know RFK Jr. did go down, and there was a video that was posted about him touring the facility that was damaged. There is one reason that a lot of times these things are not overly publicized, and that's because
To
of emotional
discourage
contagion and
copycats also.
copycatting.
Yep. Yep.
So
Yep.
I get that everybody is like, that this is awful, this is traumatizing. I live in Atlanta. There are a lot of people that this is an awful thing that's going to haunt them for the rest of their lives. If this happened, it's going to make them feel unsafe at work. I certainly would. If you've also been to the CDC, that shit is on lockdown. Like, you can't just drive in. Like, it is real. So this, I mean, there already is a lot of security at the CDC, at least the campus I'm familiar with in Atlanta. But again, there is a very well practiced communications approach to tragedies like this, especially ones that are potentially going to be repeated by people who are also angry. We have a very polarized and unhappy country right now, and that is you go silent. So just want to put it out there that this may not be people trying to cover it up or whatever. This may actually be a strategy. I don't know. I
Yeah.
don't do PR for the government. It may be a strategy by the government to actually protect the CDC employees. Just
Yeah.
saying, just putting it out there. This is real. It's crisis protocol. You can look it up on the Chat GPT even, and see all of that. So, but this actually was a really lovely post, I thought. Caitlin Jetelina, I think she spoke last year at Health Data Palooza about using data to tell
Yes,
stories of
she
public
writes
health.
under your local epidemiologist. She's really great, really good
Yeah, a
voice.
very cool approach to communicating about public health. She's also been on the Why Should I Trust You podcast video thing. And she actually, if you go read her post, you can click on a link to, I think it's, she says here, 300 letters and other communications and letters of support that she and her team have received that were delivered to CDC employees, I think today. So
Pretty
a
cool.
very nice thing. Read it to feel good. And also feel free to also tell a public health worker that you care about them and care about
That's
the
right.
work that they do, which is often behind the scenes. Oh
Just
my
really
gosh.
quickly, I want to bring up a comment that came in from Price from Redox, who is hilarious. He said, "Crazy to hear about the guy who fell down the rabbit hole with his AI chatbot," and then a moment later, OpenAI is announcing GPT-5 for
Yeah.
healthcare advice.
Yeah.
What could go wrong, Price? I don't know. We'll find out.
I don't know. I'm not sure. I don't spend a lot of time on the Chat GPT because I feel like I've created too many business endeavors to spend that much time. But maybe that's an
That's
argument
right.
to spend more time so that I could like vibe code
Hmm.
away. Like, I don't know.
No.
Anyway, speaking of communication strategies and approaches to engagement, so there was an interesting article that my buddy Aaron George of Incentive posted this week on the LinkedIn. So the AMA was taking a quiet advocacy approach to dealing with the Trump administration, as in not like the whoop guy, not going out there and giving the middle finger to the FDA, to make sure that they could maintain some lines of engagement. They were since pressured by membership and I guess lack of progress, and have now gone not at all quiet on their advocacy approach, and going very loud, and have recently sent a whole slew of letters, which are very much not nice. Depends on how you look at it, to the administration, and also taken a very aggressive stance on behalf of their membership, to fight for things. There was a lot of criticism around how they handled the One Big Beautiful Bill. They felt their members thought that they were not loud enough about the things that Josh Mandel uncovered in the comment letters that you all saw, saying that, hey, WTF, we should be really angry about this. And AMA apparently was having those meetings behind closed doors. Didn't work, so now they're going hardcore.
Isn't it crazy that this like incredibly powerful association for what like more than 100 years, I have no idea how long they've been around, like
Probably at
couldn't,
least 100.
yeah, I
Yeah.
isn't it incredible that they, with all the money they have and all the everything, like were unable to make any meaningful progress in lobbying against some of the provisions of HR 1? It's like kind of
Yeah.
wild.
It's pretty wild. It is pretty wild. I also don't know, like, and this, okay, Lisa, I had something happen this week that like has really tested my own
Yeah,
advice
yep,
on
yep, yep.
staying calm, cool, and open and willing to engage and like
Me
all of that.
too.
Like, I am, little fans, I am currently tested. I am, it's fine. But
Kat is
it's
a
like,
pragmatist, but her pragmatism has been tested this week.
but and y'all, my feelings are so big they blot out the sun. This is not my natural state to be pragmatic. It is not a real thing. So anyway, we'll see. I'm gonna have some wine tonight and see how I feel. I'm gonna not text anyone.
Yeah, yeah, yeah,
But
yeah.
anyway, but I do know, like strategically, objectively, the AMA moving away from their quiet advocacy stance actually will reduce their effectiveness in this administration, like for sure. So maybe it doesn't matter. Maybe they're like, you know what? No one freaking listened to us. All this bad shit's gonna happen. Like we're just going for it. Like we are gonna go for a change in the next 3.5 years. Like that might be their strategy. I don't know. I do know that this approach does not work if you want to engage.
Well, and also I will say this, like if you are a very progressive doctor, if you are somebody who is like considers yourself to be progressive, like I don't I'm a more of a progressive, I want progressive values, progressive things. The AMA has not for a long time, if ever, been your association. And so if you have those feelings and you expect advocacy, progressive advocacy from your association, you should be a member of AMA anyway. Sorry, not sorry. Like, and truly, I mean, now we're getting unfiltered. I've had zero alcohol today. It's only 1:45 or whatever here in on the West Coast. I am saying this unfiltered. That's not your association anyway. The AMA is not going to ever authentically represent that. And I agree with you, Kat. I don't think that they are going to get a better result by getting out there and shouting about things they may not even really believe.
Yeah. And listen, I will tell you though, it feels really good to do what the AMA is doing right now. Like it feels
Sure.
awesome.
Yeah. Feels
Kind of
good
like,
until the blowback comes. Feels good until the blowback comes. I will be watching this one with great interest to see what actually happens. Again, if you are a physician and you're expecting the AMA to be your like fight back, whatever,
oh,
you're barking up the wrong tree.
yeah, I don't know. I don't know. Same with Harvard.
Barking up.
Like, okay, I think so. I used to kind of like, as a prominent and very successful graduate of a public school, state school, Penn State University, the Pennsylvania State University, for those in the know. I kind of always like was not into like the Ivy League schools. I was like, Jesus Christ, they're so annoying and like whatever. But I will say Harvard, like standing their ground with the whole grant stuff and like with the administration accusing them of being anti-Semitic. Um, I think that was a baller move. And I heard that they might like take this deal where they pay off something or whatever. Man, I hope they freaking don't. I will say, yeah, you remove your opportunity to negotiate when you do what Harvard did, but it was kind of a baller move. Like,
Well, I
no
mean,
matter what stick.
ultimately, if you're gonna do those kind of things, you need to be able to stand behind your word. If you have enough money, if you have more money than God, more money than most countries, then why not do it, right? But just people aren't being very smart about this kind of stuff. Like, is this worth it for you to push back on? What is it? Can you really speak on that? Do you have any credibility in that area? Is there a reason? Are your members, are your shareholders, is your board behind you? Those are all questions to ask first before you do something like
Yeah.
this.
Yeah. And so y'all loyal fans will find out if I am so pissed off if all over this weekend or after a few glasses of wine, I also go nuclear. We'll see. We
We'll
don't know
see.
what's gonna happen. I
We'll
don't
see.
know.
We'll see.
Okay, thank God. See, this is why shows with me and Lisa are the best because we just get to talk at ourselves for
That's right.
many minutes. So we only have 11 minutes to tell you guys the best and worst of everything
Oh my
THC.
God.
So far, we'll see what happens. Okay, what do we have? Okay, Lisa, this is yours. You love.
I love this. I love the health technology ecosystem work that CMS is doing. I genuinely think it is incredibly important. It's long overdue. Like everything in the federal government that's actually good, it's not like brand new, right? It's been worked on for now many, many years in different ways from different people, but it's definitely time. And I commend, the group there, the leaders of CMS, Dr. Oz, all of the A team, Chris Klump, the Abe Sutton, the folks. I think I would say from my perspective right now, for them to move this forward, building on the work that career employees have done for a long time, like great. I support it. I've always
Into
thought that
it.
CMS should be behind this. So like I'm in. I love it. Let's
But
do
what
it.
do you hate? This
The
is supposed to be a
this,
feeding frenzy.
the
You're
visual
eating a
is
goat.
this is horrible. This is all
What
cat, everyone. Loyal
illustrative.
fans, like no. Uh,
See? Big
I hate
feelings.
the
They blot
feeding
out the sun.
frenzy. I hate the feeding frenzy. I really like, you know what? Like, if you're a big company, if you're a small company, we need to find ways to work together. That's what they're asking us to do. And like it just doing like fake weird stuff and putting out like fake announcements, like not my favorite.
Yeah, I will say Jim Lacey, who is now doing something, New Mountain Capital, I think. He used to always tell me, his opinion about PR is who tells the first lie, which he said with a great Southern accent, which I was obviously super insulted about. I feel like there's a lot of that going on.
Yep, yeah, yep. There is.
Who's telling the first lie or who's continuing to tell lies? Okay, what do we love? We already talked about this. We loved that doctors are getting what they want, and it's a useful product. When Lisa and I went to UGM last year, they every physician told us like this meaningfully made their lives better. They
Yep.
got to go home earlier, all that. What we don't love is sadly now, as we previously discussed, it will be hard for true innovation in this category just because of market pressures and the market situation generally. Not to say I don't appreciate Epic's approach for continuing to be dominant and have incredible market share, but it is a little sad. We do not like this. We do not like this.
Agreed.
I love the Rural Health Transformation Fund in spirit and theory. What I don't love, y'all, is like apparently this is Lisa. You'll have to validate this, and so will Melissa. But apparently, Ed Dolly talked at MESC about how only technology that has already been approved in a previous APD by CMS will be eligible for the use under the Rural Health Transformation Fund, which Jesus Christ, like, we all know the vendors that are approved under APDs. It's all the big primes, the $10 banana people. It's all like the hodgepodge shit that they put together to make a bajillion dollars and keep their contracts going. Like, this makes me so sad.
This sucks. This sucks in a huge way. And also, by the way, Ed Dolly, now that we're at it, um, dude, like
WTF, bro?
WTF, bro, and also like stop saying go talk to your state health officer when they still all say different things.
They still
Nobody
all
is
say different
aligned.
things. And then they try to ask you. And from what we've
Ed,
heard at Dolly, it's really hard to get you to give them a straight answer. So
there are
everybody's
no straight
confused.
answers. Let's just stop with the mysteries and have like clear communication here. And also, like, why are we perpetuating a broken system, Ed and everyone else? Come on.
Yeah, I thought didn't like the one of the good things that came out of the Doge cuts is that like it cleared out a lot of vendors whose sole purpose was to do scope creep for the
Yep.
federal government and the states, right? So there is an opportunity for new vendors that don't cost $1 billion that are using AI, that are using all those things, are going to be able to come in and be really useful for rural facilities that don't have any money and need a lot of help. And now, what are they going to do? Use Deloitte? Like, is that what you guys wanted? Ah, so this I hate. I hate. Hopefully, CMS friends and Medicaid, you come out with some better stuff. Because like
Yeah, this
that
pisses
that was
me off.
confusing and awful. I wasn't there, and I got 100 million texts during your session.
Amazing.
What the hell? All right.
Amazing.
We love that communications is currently the most important thing on the planet. We also hate liars and people who are fighting all the time. Bullshit. Not into it. That's
Yep.
basically everyone, including Epic and Oracle. I don't really, like. I mean, I guess Epic's not really fighting back, but like, come on, like, be freaking mature. You look like a bunch of toddlers, y'all.
This
All
is
y'all.
not a good look. It's not a good look. And also just like why? Like why are we doing this?
Yeah. Why are
Also,
you? Why
like
are you awful?
they're also not the only like competing companies who we've had complain. I mean, we've had people on this show where we've then gotten like a complaining like message afterwards from that company's competitor being like, "Why are you doing this?" Listen, like we just need to like this is not like what are we doing? Why are we doing this? Let's just like there's enough
Yeah.
for everyone. You don't need to compete like that. Compete, as
Also,
Kat has said, on your service, on what you provide, on the value you bring. Don't compete on the stupid stuff. Stop it.
yeah.
Let
Also,
leave
don't play
leave the
whack-a-mole with your
shit leave
competition.
the shit post to us. Like we are
Yeah.
better at it.
Listen,
Yeah,
also, if you're going to
thank you.
stay, like, if you're going to send us a message and say we didn't cover something fairly, last time I checked,
Mm,
we were a fake TV show
we
on
are
the
not
freaking
real. We are
internet.
not real
We
news.
are
Yeah.
often drinking. We don't prep. We kind of know what we know, and we're often wrong. So, like, you should probably go take the time that you spent to watch us and write a LinkedIn post, and maybe go provide better service to your clients.
That's
I don't
right.
know.
That's right.
Just saying. Like, I don't know. It's so hard. Oh, Sergey. You know what, dude? I think you should keep doing what you're
Keep doing what you're doing, Sergey.
doing. Just keep doing the. It's Medium, right? He's on Medium, or is he on some other platform? I can't remember. Doesn't matter.
Mm, not medium. The other one.
Okay. All right. We love that patient access platforms are super hot and cool again. We got our bestie Kristen Valdez from Be Well. She's like on fire right now. We love that they're getting money. Also, shout out to Citizen, which used to have two eyes up front, rebranding and relaunching with one eye. That is the branding.
That's innovation.
What do we hate? We hate that. Well, we hate a couple things. One is like, is this a real interest in funding these companies so they will be useful and be able to work at scale? Because that is D2C, y'all. That is really hard to do and
So
very
stuck.
expensive. Oh, it's Substack.
So stuck.
Also, in the past, these patient access platforms have very much exploited secondary use and sold the datas. So we would hope that that does not happen in this new wave, with Amy's initiative and all that. That this is going to be
By the way,
changed.
everyone complaining about Cat Slides and how she put the X mark in the wrong place. Listen, our budget is negative $5,000. So like, and she does not use
I don't know what
AI
to
for
tell
this. So
you.
calm down.
I actually checked this morning. We have a bank account that I have a certain amount of money in that I started it with. So we're never at zero, loyal fans. I would like to tell you that we are $1 in the
We're
black,
at one. We're one
amazingly, as
dollar.
of this morning. Yeah, so we'll see what happens. But anyway, yeah, listen, you guys, we make this at like 3 o'clock in the afternoon on Fridays.
That's right.
Okay, all right, real quick. Tech company we love and hate the most. I love Photon.
I think Photon is going to be honestly like if you ask me right now, like which company do you, Lisa, wish that you've been able to invest in early on? Right now, it'd be Photon. Like I think they're going to do amazing stuff. Truly,
Would you go work at Photon?
oh, depending on the job, absolutely.
Like if they were like, Lisa, you're chief of external affairs and we will pay you all the monies.
Well, they're not going to
And
because they're way too early stage of a company, and my risk
okay,
profile is much worse than that. But I would definitely
I would work at
invest in them
Photon.
if I could because they are incredible, and I think watch this space.
Yeah, I think Photon's awesome. Um, who do we hate the most? Or who do you love also? Do you love someone else?
No, I
Really
love
smart.
Photon. I think just like in terms of like doing cool stuff, I think Photon's doing something great. I'm gonna, like I've talked to some other early stage companies doing interesting things. A few have like interesting, niches that they're building out. Can't talk about it yet. There might be some in the future. But in terms of hate, everyone knows how I feel about Hippocratic AI. I've already made that really, really clear. Although I did have to meet and smile and shake hands with someone from Hippocratic just a week or two ago, thanks to you, Kat, and they seem very nice, but I still am mad at them.
Hippocratic AI was invited to the massive rager we threw after the A-Teens Making Health Tech Great Again event at the White House. It is true. I agree they were very nice. I do not appreciate their product because I don't believe in AI nurses.
That is correct.
I am not into that, but they seem like nice people. Both things can be true. I currently think Oracle is the worst. That's the company I,
I'm very much a softie, right? Like someone like in person, I have a hard time being mean to them because like I'm
oh
generally
yeah,
mean to people, but abstractly,
yeah,
I hate them
yeah.
from an
I mean, I like to
abstract
say like,
perspective.
yeah, I mean, there's lots of people that I think their companies are dumb and like, I like that. Like,
Yeah.
there's lots of people I don't like Oracle. I had a run-in with several of them that I was just like, wow, your culture seems awful. But I also like people there. So,
There's
that's a
also some
thing, but
fantastic people there. I mean, I don't understand how they're going to compete in the market here in the US of A. And I guess we'll all find out. But yeah, I mean, kind of some bad vibes from
yeah,
the
yeah.
leadership side.
And you can't fix that kind of stuff with product. Like
Yeah.
that's like gotta come from within. I don't know. So
I think
okay.
Epic very much frustrates me in a huge way, right? Like I think that they, as we've said, like I think they are, and as I've been called out for, I think that they're the best of the worst in terms of interop because they do what they do what they say and they say what they do. I just don't agree with what they do. And I just wish they would be less exclusionary and be more collaborative, but that's not in their DNA, clearly. Like I want them to
Yeah, I
be
mean it's like on their
collaborative, and
walls,
that's not
right?
what they
Like
want to
don't get
be.
acquired, don't acquire things, right?
Don't
Like
acquire,
that's
don't get
like
acquired, whatever.
yeah. I mean at least everybody knows.
At least everybody knows. Like I can give them props for that, but I wish we
Yeah,
could all be more collaborative and they'd be willing to like really do what's best. Just
yeah,
be open to the idea that what's best for their customers might not be just them.
yeah. Agree. Agree.
We
We skipped
disagree on
over
that point.
well, I think yeah, I think their secret sauce is their approach to their customers and like the
Sure.
service they provide. Like I said, no one's ever. I mean, actually, Epic, they did fly us to their thing, and we did get to see some of their
They
products. That
did. It
was
was
cool,
cool and I
but I've never
appreciated it
used it. Like, I don't know. Like, I don't know if it's any good. I've heard it's also really difficult to work at Epic, especially if you're a woman, right? Like, that's not great.
for sure.
So I think there's lots of good things and lots of bad things, but I'm currently like super pissed off at my running, which is not the same as the thing I was talking about previously, Kristen. That is a different topic with a whole nother situation. But anyway, okay, so we skipped over one. We're out of time, so we got the last thing. We did not include a person we hate the most because we just like don't want to be totally a bunch of dicks. Because
I don't really hate people.
yeah. I know you do. Michael, you are objectively great.
We love
Person
you,
I love
Michael.
the most. I actually like put this on here and don't have an answer. Um, I like a lot of people. I've been super fans of a lot of people lately. Um, uh,
I mean,
I mean,
right now,
I still kind of have a crush on Kristen Valdez because she like did that great
she's pretty
performance,
awesome. Like
and like
she's a
she is
great
just like,
person.
yeah, she also is like fun, and you want to like, you're just gonna root for her. I really like her.
Yeah, I like Kristen.
Yeah,
We'll provisionally put Kristen in this list, the top of this list right now. This list is always changing, loyal fans. Like,
as you know.
we'll just keep it up there. I would like to point out
Yeah.
that throughout this entire show, you did not cover a very important topic, which is
Good.
my new podcast. Is that
No,
coming still on the slides?
no.
What's
Oh
going on?
shit. No, no. Oh, I also have another. So this is a recency problem. I'm going to say this. I also had um, uh, drinks with Krishna from Google Ventures. That guy was super nice and great. And I feel like he was doing like ninja conversation stuff on me, which normally I do on others. And
Mm.
I like, as of this week, he's a great new person that I like. So I did not put your podcast in, but it's your sister's 40th birthday.
This is the weird cutout of a picture, but yes, Jessica Betancourt, 40th birthday today. Happy birthday. My younger sister, who also runs Emphasis Media, who work in the HIE and health IT space. So, happy birthday, Jess.
Yeah, these guys are great. They're awesome. A lot of people actually, like most people in our space, like all of a sudden I find out that they're working with the Emphasis Media
Yep,
people as well as the Uncommon Bold people. And I'm like,
yep.
oh shit, this is great. Everybody's
They're pretty
getting
fantastic.
along. And yeah, other thing is, y'all, Lisa does have a new podcast. It is professionally produced. It is not like the talk show. She is not leaving the talk show. She is just choosing to explore who she really is, which is a very
Which is a
smart
policy nerd.
corporate person. So check it out. So tell me more. Tell me more.
Yeah, it's called the Policy Stack out now. There is a video component, but it's really intended to be audio. So ideally, you just subscribe to it on the podcast platform. It's called the Policy Stack. And my first guest is someone who we've had on this show as well, Cody Kinsley, former Secretary of Health and Human Services in the state of North Carolina. He's fantastic. We did talk about Medicaid. And then I have another one coming out very soon as well, also on the topic of Medicaid. Some great stuff coming. So please check it out. It is not like this show, although you will recognize some of the guests.
Yeah. Yeah, you will recognize the guests. You will get a different thing out of Lisa's podcast when
That's
you do the
correct.
talk show.
A
Yeah.
little bit less shit talking, a little bit more policy conversations.
Yeah. Last thing, loyal fans, we also are down to $1 before we once again have to start paying our own media liability insurance through our own bank accounts. So we are being very picky with guests. We're either going to reach out to you and ask you to be on the show, or you have to be freaking stunning and amazing and awesome and have
That's
all the
right.
hot goss to be on here without actually paying to be on here. If we don't have a guest, or like often because we're not super planful people, someone else has to cancel, and we're probably not going to reschedule you either. We're just going to show up and do exactly what we did today is trash talk.
That's right.
So
That's right.
the update for now. We'll see what happens. But yeah, that's it. Lisa, I hope you do all of your work on the weekend that you missed by going to Milwaukee.
Me too. It's going to be amazing. All right,
And
everybody.
we'll see if I go nuclear over the weekend. TBD.
Yeah, TV. We'll find
We'll
out.
see. All right.
Bye.
Bye.
See you later.